Hello everyone, my name is Grace. Welcome to another segment of Vitality Health Features interview. Today I'll be chatting with someone whom I've known for a decade, 10 years, but I hardly had the time to speak to him because of his tight schedule. He's none other than Dr. Steve, my chiropractor from Full Potential Chiropractic. Yeah, he is originally from Korea and his family moved to New Zealand when he was 11 years old, and he graduated from the New Zealand College of Chiropractic and very passionate about what he is doing. So let's welcome Dr. Steve. Hello, Dr. Steve.
Hello, Grace. Thank you so much for inviting me. And yes, it has been 10 years since I've met you first when I moved to Singapore. So yeah, I'm actually surprised myself that we didn't really have a time to catch up personally like this. And yeah, so thank you so much for inviting me to your Vitality Health today.
Thank you. So, okay, I'm going to dive into the first question. Could you give us a brief history of how you became a chiropractor? What made you decide to be a chiropractor?
Yeah, okay. So I actually, when I went to chiropractic school, I don't think I really knew what a chiropractor actually did. I think throughout my school years, I studied really hard and I've always had decent and good grades, but I never really thought about what I really wanted to do. And growing up, being Asian, of course, in a Western country, my parents wanted me to become a doctor or a lawyer, something like that, And then, so yeah, without really thinking about it, I went to university wanting to be a medical doctor. And then I went through the first year of the medical degree. And then I had the grades, and then I went through the medical school interview, and then I failed. I didn't get in.
Oh.
So yeah, so at that point I was really panicking, and I didn't really think of anything else I wanted to do. And my father was seeing a chiropractor at the time, and then he was like, "Hey Steve, why don't you go and look into becoming a chiropractor, because they're kind of like doctors too, and then a lot of people are sitting down nowadays, and I think it might be a good job for you. It could be a very stable job, good income, could be good." So I thought, okay, why not? I'll just go and see what it's like. So I went to the chiropractic school, and then yeah, it just sounded okay, so I just decided to do it. And then I think it wasn't until when I went through some classes at the college that I realized what chiropractic was really about. And that is that it's not about just cracking your spine or fixing neck pain or back pain. It's a very different way of looking at your health, where chiropractors believe our body has this innate power to heal itself, and it expresses that power through your nervous system. And chiropractors, by adjusting your spine and improving your nervous system, it allows you to be as healthy as you can be. So that was very inspiring for me at that point. And then from that moment on, I decided that this was kind of the calling for me.
Wow, that's
Is that okay?
Yeah. Was that 4 years, 5 years of
So yeah, generally it depends on the country, but in New Zealand it's 5 years of study. Yes. Yeah, so the last 2 years of the school, you do an internship. So when you're studying, you're still seeing patients at the school clinic. So after that, as soon as I graduated school, I moved to Singapore, and probably saw you that year, I think.
Yeah. Yeah, you look like just fresh out of college.
Yeah, true. Yes. Yeah. At that point, yes.
But you must have 2 years of experience of internship before you come out and practice.
Yes, you must have 2 years of clinical experience, which is actually quite difficult. You need to see a certain number of patients and go through a lot of assessments to make sure that you are safe to practice. And at the end of that, we also had a separate chiropractic board exam where you do practical tests and theory tests and all these things to make sure that you're qualified.
What does a chiropractic session with you entails?
Okay, so before we decide whether someone is suitable to receive a chiropractic session, it usually starts with a chiropractic checkup, where we do a number of exams, like physical exams, history taking, sometimes x-ray, to really find out what's causing your problems. If you're having neck pain, lower back pain, there can be lots of different causes for it. Chiropractors obviously cannot treat all the causes. The only cause that we can fix is if it's coming from a misalignment of the spine that's putting pressure on your nerves, you see. So we'll do these exams to see if you have that. And if you have that misalignment condition, which is also known as a subluxation, then we fix it by doing what's known as a chiropractic adjustment, which is a very specific kind of physical force and pressure into the spine to put it back into the right place and take the pressure off. And it's usually done with our hands. We have special tables and tools to do that. If you ever watch these satisfying like cracking sound videos on YouTube. It's kind of like that, and often you'll hear popping, clicking sounds. I'm sure Grace will know.
Yes. Sometimes I'll say ouch, but
Yes.
you.
Sometimes it can be a little painful, but generally it feels good afterwards. Yes.
How do you think you can help people with this form of wellness? I suppose this is called wellness.
Yes, yes. It is called wellness, and that's kind of one of the big fundamentals of chiropractic is that it's not about just treating someone's neck pain or lower back pain, although that is an important part of what we do. But most importantly, we want to help people be as healthy as they can be. Okay, so our body, everything that happens inside of us is controlled and governed by your nervous system. So when we adjust your spine and your nervous system is flowing better and more healthy, then your body can function better, perform better, and be as healthy as you can be.
To see the positive result, could they see it within a single session?
Yeah, some people do, and I think it depends on how old you are and then how serious your condition is. But if you're a young person and if it's not very serious, then yes, of course, you can feel a lot of improvement within the first 2-3 visits. For some people, it takes longer also. Yeah. But the other thing is, sometimes when you feel better, your symptoms might improve, but internally you might still have a problem, you see. So I guess in terms of correctly, like properly healing and in correcting everything, for everyone, it will take some time. Yeah.
Actually, I'd like to share something about myself. I think that time, my first session was not with you, but was with Dr. Zach.
Yes, yes.
Right after the first adjustment, I don't know, it was so subtle. Suddenly, I just felt much better. I don't know, it's as if some blockage was cleared.
Yeah, exactly, yes.
But of course, I agree with you in the sense that it is a journey. It takes a while, because if it took so many years for you to accumulate all those blockages and that poor posture that you've been having, I think I sit properly now. My chiropractor. Okay, let me see. Balance my shoulders. Okay, sometimes because of poor habits of the way we sit or we stand, and then sitting for long hours, so it really takes a while for you to see the positive results. But we have to be consistent with our visits to the chiropractor, correct? Consistent.
Yeah. Yes, yeah, you're exactly right. And I think nowadays in the world that we live in, we're used to having things very instantly.
Yes.
Like, we want instant food. Everything is fast, right? But when it comes to our health and our body, it just doesn't work that way. Just like you said, if you have a problem because you've been sitting in a bad way or hunching for 10 years, you cannot expect that to go away in just like 2 weeks or 2 months even. Sometimes it takes a lot longer than that. So I think it's important to have like a reasonable time frame with the goal.
Dr. Steve, what do you feel about, because chiropractic to me is just about adjusting the spine, I mean, the skeletal system, which is the nervous system, but what happens if that person has very tight muscles, very tight fascia? Now people are talking about fascia. So if their muscles are tight and then they let you adjust, will they still see improvement, or they still have to do some exercises to maintain their posture, to help build up maybe certain muscles so that they can hold up their posture properly?
Yeah, I think what you said is very true, and both are very important. So first of all, yes, some people, they just tend to be very, very tight. So chiropractors are trained to feel that. And then usually when we're adjusting your spine, we will palpate or feel your bones and your muscles, and then everyone will have this short window where they will relax. So that's when we deliver the adjustment and move your spine. For some people like you, the window is very short. Okay, so we are trained to do that. And at the same time, we also have lots of other different techniques. So chiropractic is not just about cracking and making these sounds. We have other techniques that are more perhaps gentle, such as like an activator or drop table. So we have other ways of dealing with it if someone's very tight. And as you said, I completely agree that exercises are very important. It's not, we got to look at everything. Chiropractic adjustments to fix the bones, that's not the only solution that will fix everything. You need to make sure that your muscles are not very tight and strong and supportive, supporting the bone structure. So I agree, the exercises are just as important.
maybe I'm asking on behalf of a lot of people, the
Yeah.
cracking sound of the chiropractic adjustment, how
Yes.
safe is that?
So how?
How safe is that?
Oh,
Because when
yeah.
you hear the loud cracking sound, especially when they say, because when, I don't know, when you speak to people about neck adjustments, and they'll say, oh, don't do that. It's not so good. You know, you hear the cracking sound and all that. I don't know.
Yeah, okay, so yeah, I think a lot of people have misconceptions about the sound coming from maybe the bones like grinding each other or moving past each other, but that's not the case at all. It's just gas releasing from your joints, okay, when your joints move very, very quickly. So it's quite safe. Yes, it is true that you shouldn't anyhow like crack your neck or twist your neck yourself or go to a Thai massage. It is a very obviously delicate area. We have lots of important blood vessels and nerves that pass through it. So if you move it the wrong way, of course, you can hurt yourself, yes. So that's the exact reason why you need to see a chiropractor who usually studies 5 or 8 years in the States, just learning how to adjust the spine effectively and safely. So if you're seeing a qualified chiropractor, then you shouldn't really have to worry about, breaking your neck or anything like that. Yeah.
What happens if when you adjust a person and you say that at that moment that person is relaxed, but what happens if that person happened to move when you're adjusting?
Yeah, I mean that's something that rarely happens, but if it does happen, then I guess you'll probably have some muscle pain when you move, but it won't cause any serious harm or side effects. But you'll probably have some soreness. It's just like so we need your help in terms of like us doing a good adjustment also, because we need you to be relaxed.
So you have so speed is important for you. Must be very
the speed and the precision and the depth of the adjustment, all that's very important. I mean, if you go to a hospital and if you're getting an injection, right, and then if you're very uptight, then yes, it'll be very painful for you also.
Yeah. So Dr.
It's
Steve,
the same thing.
Is there any occupational hazard as a chiropractor?
Yes, yeah, definitely, because I think our job involves bending down a lot. You've probably seen that when you come to office.
Yes.
Often we're bending down and looking down at our practice members and adjusting. So I think repetitively doing that over the years, it can cause some issues in our lower back. So that's quite common. And also we use our hands to do everything. So my wrist and my finger joints, they've begun to hurt quite a bit as I'm getting a bit older. So I think, yeah, those are definitely common occupational hazards. I think that comes from being a chiropractor, I guess. Yeah.
So what do you do when you have all these issues? You adjust each other?
Yeah, I think that's the best part, is that at least if we have a problem, we have someone there to take care of it straight away. So I think that's kind of helped me keep going until now, and seeing the volume of patients that we see in our office. Yeah.
You spend a lot of time in the chiropractic office doing adjustments. So how do you keep fit, and what kind of sports do you engage in?
So yeah, I mean, personally, I try to go to the gym about 2-3 times a week. And then I like running, so I don't run as much, but in the past I've done kind of long runs. I haven't done a marathon, but I've done a half marathon. And yeah, I just like being outdoors. I do windsurfing and wakeboarding, so that's something that I enjoy a lot, and I'm very passionate about those.
Windsurfing at East Coast?
Yeah, at East Coast, yes.
Oh.
Yeah, they have windsurfing there. Also have at Pasir Ris. No, not Pasir Ris. No, out near Tanah Merah. Yes, yeah.
Oh, okay. Wow, you have to learn how to read the direction of the wind and adjust the sail, isn't it?
Yes, yeah, you need to do all that. Yes, yeah. I mean, I'm still learning and still somewhat new at it, but yeah, it's a very good sport, and I think that's one of the great thing about Singapore is, I think other countries where they have seasons, right, they can only do these kind of things in summer, But in Singapore, it's just available to you like all year round. The weather is sunny and it's hot and it's beautiful weather, so I really enjoy that. Yes.
Except that when it's going to rain, you better get to see because of the lightning.
Yeah, like right now, I think, yes. It's raining heavily where I live. Yes.
Do a lot of sports, huh? What, wakeboarding, windsurfing, marathon, half marathon. How many kilometers is half marathon?
I think it was 21 point something. But don't get me wrong, I'm not like good at running. I just do it, but I'm not like fast or, professional runner or anything like that at all.
Just participate in the event.
Yeah, just participating, you know.
Everyone encounters highs and lows. So what do you do to perk yourself up?
Okay, I can say, yeah. I think my honest answer would be maybe to have a few beers when I'm stressed.
Beers.
Yeah. Okay. I mean, I think that's okay. I think every now and then, it's not like I'm drinking a beer every day, but I think certainly on some days, if I'm stressed, I think having a couple of beers is always nice, emotionally. But however, I think I like going for walks. I think during the circuit breaker, because I stay alone in a tiny house here, it was kind of very depressing in the beginning and lonely because I couldn't really meet anyone. So the whole day I was by myself. But going for walks, it really helped for me because I think it allowed me to notice things around my neighborhood that I perhaps didn't see before, like the trees or the little gardens and the parks and everything. And it allowed me to appreciate the smaller things around me. And I think being grateful is one of the best medicine you can take when you're feeling down. Just the fact that I am alive and breathing and have this day as a gift. I think that's a blessing, and that's something that always lifts me up when I'm feeling down.
Yes. Actually, a lot of people were commenting about how the unkempt grass was looking so attractive now.
Yeah, yeah, with all the butterflies and everything. I love it, yeah.
Looks so good,
Yeah, looks very, very good.
During the circuit breaker, see a lot more people jogging or just doing evening walks. Really nice.
Yeah.
Very good.
It's very nice, yes. So when I do go for walks, I like to listen to like classical music. Now, I'm not very familiar with the names of the songs, but I do like piano, classic, like nocturne, that kind of.
Nocturne, that would be Chopin. Chopin is
Yeah. With all, I know they have all these like names, long names. I don't remember them, but that's the playlist that I'll usually listen to. Yes.
Hey, Dr. Steve, do you cook?
Yeah, of course I have to. Yeah.
So what is the comfort food that you prepare for yourself?
I go through like different cycles. So if I'm really enjoying something, I'll just make that for a few weeks, and then I'll get sick of it and move on to something else. I think lately I've been making lots of stews at home. Like Korean stews, that's a comfort food for me. So I don't know if you know about like army stew or kimchi stew, those kind of stews, kind of spicy and hot. Yeah.
Are they easy to prepare?
Yeah, they're very, very easy. Yes, very, very easy.
But you have to create your own soup stock, isn't it? Or you use?
Yeah. Actually, nowadays they have the prepared, it's just pour that in. Yeah.
Do you have a favorite book that you like to read?
I think one of the most impactful books that I read in my life was called Success Principles. It's basically the main message of the book is that you have to be responsible for everything that happens in your life, and how wherever you are in your life right now, you are there because of all the choices and decisions you've made up until this point. And you shouldn't blame your parents, or you blame environment, or blame anything else except you. And that also gives you power to create the future moving forward that you want. Okay, so that's one of that's something that I try and remember every day and live by. It's taking 100% responsibility for everything that happens in your life.
Okay. Thanks for sharing. What does Vitality Health mean to you?
Vitality Health means being as healthy as you can possibly be. It's not just, I think being healthy is not just about having no pain or no symptoms. Sometimes it's okay. It's in fact healthy to have symptoms. Certain things like we experience when we are sick, like coughing or having fever, those are normal immune responses that our body makes so that we can fight off the virus or the bacteria, right? But I think a lot of people are focused on just getting rid of these symptoms and just feeling good all the time. So for me, Vitality Health means kind of embracing that as part of our body working the way it's supposed to, and just exercising, eating well, and then having a positive attitude all the time to really be as healthy as we can be.
Okay, that's very good. Thank you, Dr. Steve. I agree with you because a lot of people are looking for quick fixes.
Yeah.
Whenever they have an issue, they say, they have to take medicine. Of course, we're not here trying to say don't take medicine, but it's just that you have to, first of all, you must be thankful that you have this very intelligent body system that's given by our Creator. and respect it. If you're having that symptom, maybe it's just trying to tell you, oh, you need a rest. You need to drink more water. You know,
yeah, I mean, yeah, exactly. Yeah, I agree.
Or maybe there's something that you have not looked into. Maybe you're lacking certain vitamins, minerals. I don't know, something that is lacking. So it's just like it's time for you to check in with your body.
Yeah, that is true. I mean, I agree. I think there are times when you have to take medication, of course, you know, that's very important, and that saved a lot of people's lives and everything, but it shouldn't be the first thing that you take all the time, I think. Just like you said, maybe you can look at like your diet. Are we missing certain minerals, or, you know, so like essential oil in our body or something like omega-3, you know, and then am I not active enough? Do I need to exercise more? And focus on these things first.
Yes.
Yeah. Because like you said, our body does have an amazing ability to heal itself, right? And so we should let our body do its job.
Okay. Thank you, Dr. Steve. I learned a lot from you during this.
Yeah, this was
because every time I meet you, it's like, okay, adjust, and next person. Okay, I need your job. How many people do you adjust in one day?
I think it depends on the day, but I think when we were busy, I think we were adjusting 150 sometimes. Yeah, more than that in one day. So now not like that anymore. Yeah. But you remember when it was very busy for us 3 years back, right? When we had Dr. Beck.
Goodness, like doing.
For me, Vitality Health means living your life to the fullest and being healthy as possible. And by being healthy, I don't mean having no pain or no symptoms. It's really allowing your body to work as it should and expressing itself fully. And that's what chiropractors help your body to do. Thank you, Vitality Health.